The health department says another 2,792 people have tested positive for the coronavirus in the latest reporting period, taking the total number of cases recorded in South Africa to over 1,665,000. An additional 67 people have died from COVID-19 related complications. Now, the death toll stands at 56,506. 490,680 people have been vaccinated with the Pfizer vaccine in terms of phase 2 of the rollout of the jabs, and more than 479,000 medical personnel have been vaccinated under the Sisonke protocol or program. Now, an interesting and seldom discussed aspect of the COVID-19 pandemic is how it affects children. According to the National Institute for Communicable Diseases' latest COVID-19 in children report, this came out at the beginning of May 2021. People under the age of 19 made up 9.4% of the total number of COVID-19 tests in the country. So to help us unpack some of the trends in COVID-19 numbers in specifically children, we are joined by Dr Tendesayi Kufa-Chakezha, who is an epidemiologist at the National Institute of Communicable Diseases. Doctor, thank you very much for joining us. It's good to have you on Morning Live.
Thank you very much for inviting me.
So the NICD releasing a very interesting report in terms of infections and testing in children. Perhaps you want to give us just a broad outline of how things are looking, COVID-19 in children in a South African perspective.
Okay, so thank you for that important question. When the COVID-19 pandemic started, there were a lot of concerns that children were going to be the hardest hit. Anyone who has a child will tell you that once your children go to school and they go to preschool, they'll come back with respiratory infections and they pass it on to everyone. So we were very concerned that children will be the main drivers of this pandemic. But with time, we have noticed that children are not driving the COVID-19 pandemic in South Africa or anywhere else in the world for that matter. As you were saying earlier on, at the moment, when we looked at the data from the 1st of March, beginning of March, when we had the first case, up until the 1st of May of 2021, children made up 9.4% of all the cases, and that translated to about 148,000 cases recorded in children under the age of 19. And they made up 3.8% of the admissions to hospital with COVID-19. And when we say to admitted to hospital, we don't always know why these children are even admitted. Sometimes they're admitted for other things, and as you know, they get tested at admission, and then maybe COVID-19 is a coincidental finding, that we're finding it because the child has to be tested for admission. But having said that, children are affected by COVID, and children of all ages, from infants to the day-olds to the 19-year-olds, as you said, are all affected by COVID. And the rate at which they're affected differs by age. What we're finding is that in terms of new cases or testing positive, that increases with age. But in terms of admissions, we tend to see the younger children being admitted. So we have an increase in admissions at the extremes of age in childhood. So the very young and the older teens are the ones that tend to be admitted more.
So when we talk about very young, I mean, I see some of the breakdown of the numbers. It says that 9,918 reported COVID-19 admissions or associated admissions amongst individuals below the age of 19 years old. The incidence of admission among children aged below 19 was 13.3 times lower than those that are above 19 years old. So,
yes.
that's the reality.
When we compare,
Carry on, please.
No, I was saying when we're comparing adults, anyone which is 20 years and above, to our 19-year-olds and below, the rate at which they're admitted is 13 times lower than in adults. So they're admitted at a much lower rate than in adults.
So when I dig further, it basically shows that the highest admission is for individuals below 1 year of age. So to the very, very littlies. That's where we find that there's the highest admission, followed by those between the grouping of 15 to 19 years old. So I know you mentioned this in your previous answer, that it's
Yes.
the upper end and the very lower end. So those are the ones that we really need to watch out. In between, they tend to handle it or be asymptomatic or have your common cold and flu symptom. Is that pretty much so what this theory is showing us?
Yes. So COVID in children tends to be much milder compared to adults. And that's why you see that although the cases are only 5.5 times lower than in adults, the admissions are 13 times. That means most of the children that get COVID or test positive for COVID have mild symptoms that don't require them to be in hospital.
Yeah. I'm also reading, though, on the death toll here. Among those that have been admitted, 9,443, there were 401 in-hospital deaths, giving an in-hospital case fatality of 4.2%. Breaking down the deaths, 146 were among adolescents between 15 and 19 years old, and 125 were below the age of 1. What are we reading into this? Because, I mean, one death is too much, that we do know this. But, I mean, just, you know, this is obviously, these are the groups we need to worry about. And, I mean, the fact that there are deaths, are they due to comorbidities, or are they genuinely from COVID and related illnesses that come from that, or symptoms that come from that?
So this is the major limitation of our data. We don't always know why these infants are admitted, because the data that we get is reported to us by hospitals. They fill in an electronic form and they submit the data to NICD for every COVID-19 admission they get. So, you know, the data that comes through to us doesn't always say if the death was not related to COVID or if it was related to COVID. There are some reasons where the deaths are obviously not due to COVID. Say, for example, a motor vehicle accident, and those deaths we already exclude. So we exclude deaths that we know are obviously not related to COVID, as the attending clinicians have reported. But so the ones that we have left with us, COVID may be associated with the death, COVID may not be associated with the death, but the child was in hospital and they had a COVID-19 diagnosis. So that's, they had COVID-19 diagnosed as well. So we don't know if the deaths are purely due to COVID and if the deaths are due to other things. But what we know is that children with underlying conditions are more likely to die when they have COVID. Because what we see in the report, we don't have data on all the children that were admitted and what they're, we don't have data on all the status of the underlying conditions for all the children that were admitted or died. But for those that we have data for, about 60% of those children had one or more underlying conditions that they had. And so the very young most likely had other underlying conditions. Prematurity is a big one.
Yeah.
And if you try to think about and other respiratory infections, pneumonias, so if you try and think about where the under ones are, they're usually with their mothers, and also so they may also, likely to get COVID from their moms when their mothers are diagnosed with COVID, but also maybe when they are born, the mother has COVID, they are born in hospital, they also get COVID. We're not really sure why COVID-19 seems to disproportionately affect the very young in this instance. Yeah. So there are studies ongoing with other partners and other organizations that deal with children, looking specifically at these questions.
Oh, these little babies are just, they're so delicate. You just want to protect them at any cost.
Exactly.
So, but it is important. Yeah. It is important for parents and people to know that the little ones below 1, we really have to take care of them in this particular environment. Let's talk to schools, however, because we have been seeing, and I personally having kids at school, I remember during the first wave, the second wave, look, I must say, we weren't at school too much because we were on holiday and then schools remained closed. But there seems to be, in this particular wave that we're starting to see growing, more children that are getting it and more classes that are closing down because they are the ones infected as opposed to living in a house with a parent that is infected. So Are we finding that there tends to be, or is it too early to tell? Because I know that this was only from the beginning of May. We would obviously need to wait for the next set of data to come out. But are we seeing a trend that children are getting more infected in this wave than previous waves?
As you say, I think it's too early to tell. We'll have to look at the next iteration of the report to see what that trend is. But having said that, if you think about what you have just said, that a child gets COVID and the school has to close and everyone who's been in contact with the child has to test also for COVID. So I think we are likely to pick up more cases. I think that in the other waves, because children were not in school as much as they have been in this run since the second wave, they may have been infected to a much greater extent than what we are picking up in the data, but because their disease tends to be mild and not as severe as in adults, they may not get tested. So what we are seeing may be an artifact of testing, that we're just testing more children because they are in school. And once you get one case, you test 10 or 15 children around the one child that was COVID positive, and the school closes. So it may be that we are testing more children, but it's really too early to tell whether this wave will affect children more. But what we found in the first and the second wave was that there was no difference in the extent to which children were affected between the two waves. And I've qualified that earlier on, saying that maybe now that schools have been open for longer, and we're starting to see cluster outbreaks in schools and testing more and more children, especially for older adolescents and teens, we might be seeing more cases, not because the virus is now affecting more children than before, but because we're just more vigilant and testing more children. But we'll have to see.
I want to talk about I suppose I'm throwing our conversation way into the future, and this may not necessarily be your field of expertise, but I see that some countries around the world are now starting to do trials on children under 12 years old to see how they react to the vaccine. I know that Pfizer was also approved for people, I think, children between the ages of 12 to 15 years old in Japan. They had done that. They had approved it. But I mean, where are we with vaccinating children? Is that something you're even looking to at the moment? Or, I mean, I know here in South Africa, we still, we were a drop in the ocean. We still nowhere in the population. But when it comes to vaccinating children, I'm wondering how parents and people are going to be feeling about that.
I think, to the extent that our vaccination program is lagging with other countries, it really helps us to see what data is coming out from other countries. So I think by the time we have to make a decision to vaccinate our children, there will be a lot more data about how vaccination has been going in children, what side effects they have. And so I think that our parents here will be more reassured because there will be a lot more information about how children handle the vaccine. We don't expect that their reactions will be different from that of adults because at the moment we're not seeing the data that's coming out in the countries that are vaccinating the older adolescents and teens suggests that it's very well tolerated in those age groups. So we don't expect to see that the vaccine will have side effects that are any different from that of adults. But in terms of where we think we're going with vaccinating children, I think that when the opportunity comes, we should offer vaccination to children with underlying conditions. When we open up for people with underlying conditions under the age of 60, maybe we should also consider children with underlying conditions. So we have children with diabetes, children with asthma, children living with HIV, those kinds of age groups. Because our report, to the extent that the data is available, also shows that children with underlying conditions are overrepresented among the children that die. So I think that they are a priority group. But the rest of the children, when the vaccine is available, maybe the older teens starting off with that, as you can see from the report. And I think the infants might be taken care of when the mothers are vaccinated as well, like when all the adults are vaccinated. And I think that the infants will be protected through that because, we think that just from an exposure point of view, the adult pandemic drives the COVID-19 in the younger children.
Let's leave it there for this morning. Thanks very, very much for talking to us this morning. Dr Tendesayi Kufa-Chakezha, epidemiologist with the National Institute of Communicable Diseases, talking to us about the COVID-19 within children and the report that was released on the 1st of May, just talking to how many children have been infected. And I think in a nutshell, what we need to take out of it is that children below the age of 1 are more susceptible, and those between the ages of 15 and 19. All right, that leads us up to 7 o'clock here on the program. Let's get our latest news bulletin.